Hello everyone. Welcome to Ask Me Anything session on breastfeeding your baby. Myself Dr. Tanema Singhal and I am a lactation consultant practicing for last 14 plus years online as well as offline. So offline consultations, my clinic is located in Lucknow and online consultations are all over the world. So I have plethora of mothers who are connected with us from all over the world. So let's start the session for today. So I have few questions which are already asked by mothers. First, I'll take those questions and then the questions I'll take which are in the chat box. So if you have any questions, write them in the comment box or in the chat box and I'll take them after I finish the questions which have already come in the Google Sheet. So I'm starting the sessions with the questions which have already come. So first question is from Sri Latha. How to increase breast milk supply while baby is on formula feeding? So Sri Latha, first of all, we need to understand that if the baby is taking formula feed, that is the other milk, other than the breast milk, then what is the system that milk gets made in our body? There is a demand which the baby creates when the baby suckles on the breast and it goes to the brain and brain starts making milk accordingly. Suppose that demand is not happening because of giving formula milk to the baby. Then obviously when the brain is not getting that demand, the milk supply will not increase. So that's why if we are feeding our baby on formula, then we have to either try two of the things. Either we should try to put the baby on the breast along with formula feeds, or if the baby is not coming on the breast, then we have to regularly pump so that there is demand for our brain to make supply of breast milk. So this we have to work in a way that we have to create demand to have supply. So the demand supply chain, when done properly and the body is supported, mother's body is supported properly, then definitely the milk supply will start increase. And that way you can get your baby from formula feed towards the breastfeeding. Now next question is from Asia. क्या बच्चे बराबर सांस ना ले पा रहे हों इस वजह से ब्रेस्ट फीडिंग नहीं करते हैं? अगर आपने बच्चे को होल्ड अगर ऐसा किया है कि बच्चे की नाक बंद हो जा रही है और बच्चे को नाक से सांस नहीं आ रहा है, तो बच्चा ब्रेस्ट फीडिंग नहीं कर पाएगा. बच्चा अपना सर पीछे खींचेगा और अपने आप को ब्रेस्ट से दूर करेगा. तो आपको ये ध्यान देना है कि आप बच्चे को किस तरह से फीडिंग करा रहे हैं. अगर आपका बच्चा प्रॉपरली, उसका नेजल वे खुला हुआ है, उसको लेने में दिक्कत नहीं आ रही है, तो वो आराम से ब्रेस्ट फीडिंग करेगा. अगर बच्चे को कोल्ड है, कोई प्रॉब्लम है और बच्चा उसकी वजह से फीडिंग नहीं कर पा रहा है, तो ऑब्वियसली आपको ये दिक्कत आएगी. तो आपको ध्यान देना है कि बच्चे को सांस लेने में दिक्कत ना हो जब वो ब्रेस्ट फीडिंग करता है. अगर उसको ये प्रॉब्लम नहीं हो रही है तो आप डेफिनेटली बच्चे को ब्रेस्ट फीडिंग करा सकते हैं. नेक्स्ट क्वेश्चन इज फ्रॉम सौम्या. Is there any easy way to breastfeed without any particular hold angle? Yes, definitely, Soumya. There is nothing like any particular hold angle. You have to try in different kind of techniques and positions. So the different positions are cross cradle hold, football hold, side lying hold, and laid back hold. So there are different kind of hold which you can try, and whichever works best for you and your baby, and you and your baby are comfortable, you can follow that. The basic things which you have to focus is about the latching position. If there is deep latching, then it will be comfortable for both you and your baby. But if the latch is not correct or the latch is not deep, then you will have problems that the baby will not able to empty the breast, and that way the baby will be having to dependent on the formula milk. So these things are important when we talk about latching. Next question is from Saundarya about position. So what do you mean by position? I didn't understand. Please write your question properly. Next question is from Shalini. When baby refuses breast after bottle introduced? Yes, of course. Now, why do babies want to bottle feed over breastfeeding? So bottle is easy for them. They don't have to make efforts. There is seamless, good flow of milk from the bottle. Also because the flow is good. So that's why the babies start refusing breast over bottle feed. So in that way, what we need to work upon is we have to improve the flow of breast milk, and also we have to improve the supply of breast milk. If we are able to do these two things, we can get the baby from bottle towards the breastfeeding also. Next question is from Divya. Less milk supply, so my 15 days baby is not at all sucking. So Divya, if your baby is just 15 days old, then definitely you will be having milk supply what you need to follow is different tips which I'm going to tell you. And please everyone listen carefully, because this question keeps coming to me, that how to increase the breast milk supply. So when we talk about low milk supply, there are a few things like supply and demand. As I told you that you have to keep trying the baby on the breast every time whenever the baby demands milk. If your baby is not coming on the breast, then try to do pumping for that. So this way you will be able to express the milk and it will help to create the demand for your brain to make more supply. This is number 1 point. Number 2 point is by creating good hydration in your body. So take at least 3 liters of water every day. Third, by improving the flow of the milk. So for improving the flow, you have to do oil massage and warm compress on the breast. That will improve the flow. Fourth thing is regularly that you have to regularly check the baby's weight. So baby's weight is a good indicator of knowing how much milk the baby is getting per day. So if your baby is on like breastfeed, then how you will know that your baby is getting enough milk or not? If your baby is on like if you're pumping milk and giving it to you, you are able to see the quantity of breast milk, but you will not be able to assess the quality of breast milk. So that's why you need to check the baby's weight. If the baby's weight is increasing and the formula milk is coming down, then definitely you are on the correct path. Fifth thing is about the support of the medicines or the galactogogues. So the most common thing which I recommend is Lactomagic powder and Moringa or Morico tablets. So these two are very good, and there are some other medicines, but they are to be taken only under the guidance of a doctor, lactation consultant doctor. Then only you will be able to get details of that. So if you want to have the details about the proper consultation guides, then you can reach out to our team. So our team is available from 10 a.m. to 6 p.m. You can contact them and they will guide you about the consultations, and you can take one-on-one consultations. We have a team of 3 more doctors in our team. You can take consultations from them. Next question is from Ritu. Low breast milk. So I have just answered about this low breast milk. And also one more point is about improving the milk supply is keeping the baby skin to skin with you. So at least keep the baby skin to skin 3 to 4 times. That improves the relaxin hormone in your body. And also there are better chances for baby to come on the breast along with the improving the breast milk supply. Next question is from Kajol. Is there any feeding quality like good or bad which can impact baby's growth? So when we talk about feeding quality, I am not able to understand your question, Kajol, that what do you mean by feeding quality? So basically what I understand is here about the latching which you're asking. So there are deep latch techniques. So if you can have the baby on deep latch, that will help to improve the milk flow in the baby's mouth, and also it will help to empty the breast faster in a better way. So that will improve the milk flow, and also it will help to improve the milk supply also. And how it can impact the baby's growth. If there is shallow latching, the baby will be able to have only the fore milk, which will not improve the baby's weight. So that's why if your baby is having a deep latch, then the baby will be able to empty the hind milk, which is important for the baby's weight and for baby's brain development. So all these things are important when we talk about latching and about feeding techniques. Next question is from Ria. क्या मेरा भी सेकेंड आवरली ब्रेस्ट मिल्क 75 से 90 ml हो सकता है क्या? अभी तो 10 से 20 ml ही आता है, मिल्क प्रोडक्शन ही कम हो गया है. हाँ रिया, देखो रिया, आपको कभी भी ये नहीं देखना है कि कितना मिल्क आपको चाहिए. आपको ये चीज देखनी है कि जितना भी मिल्क आपका प्रोड्यूस हो रहा है उससे क्या फॉर्मूला मिल्क कम होना शुरू हुआ है. अगर बच्चे का फॉर्मूला मिल्क कम हो रहा है और बच्चे का वजन बढ़ रहा है, यानी कि आपका ब्रेस्ट मिल्क का क्वालिटी और क्वांटिटी दोनों इंप्रूव हो रहा है. कई मदर सिर्फ इस बात को लेके परेशान होती हैं कि मेरा ब्रेस्ट मिल्क बहुत कम आता है, मेरा ब्रेस्ट मिल्क बहुत कम आता है. लेकिन अगर आपका जितना भी मिल्क आता है उसको अगर आप अपने बच्चे को पिला रही हैं और बच्चे का अगर वेट बढ़ रहा है और बच्चे का ऊपर का दूध कम हो रहा है, यानी आप बिल्कुल सही कर रही हैं. आप उसमें बिल्कुल कंफ्यूज मत होइए और आगे बढ़िए फटाफट, जिससे कि जल्दी से जल्दी ऊपर का फॉर्मूला मिल्क देना बच्चे को कम हो जाए. नेक्स्ट क्वेश्चन इज फ्रॉम शिवानी. My baby is constantly feeding for 3 to 4 hours at a stretch since he is born. He is 20 days old. Is it like a constant cluster feeding? So Shivani, if your baby is feeding for 3 to 4 hours constantly, that means your baby is going through a growth spurt. This is a cluster feeding which is done by nature to improve the breast milk supply and also to improve the breast milk quality, like to regulate the milk supply. So since your baby is just 20 days old, so it seems like a second week growth spurt. So growth spurt comes at different intervals like 2 weeks, 6 weeks, 3 months, 5 months, 7 months. So if your baby is 20 days old, he has just passed on with the 2 weeks growth spurt and will be moving towards the 6 weeks growth spurt. So don't worry right now if the baby is feeding regularly. You just need to check whether it is a passive feeding or active feeding. And how to know that? When you take the baby on the breast and when you can see the suckling movement in the baby's neck. So how do you see that? When you drink some liquid, you can see the gulping movement in your neck. So if that gulping movement you can see in your baby's neck, that means the baby is doing an active feeding. But if you are not seeing that active feeding in the baby's neck, that means baby is not drinking milk. At that time, you can remove the baby from the breast. There is no benefit of having your baby on the breast with an passive feeding. Next question is from Aditi, low milk supply. I already answered Aditi. Next question is from Ankita, low milk supply, already answered. Next question is from Nandini. ब्रेस्ट मिल्क सप्लाई कम हो तो लैचिंग में प्रॉब्लम हो सकता है क्या मैम? नंदिनी, अगर ब्रेस्ट मिल्क का सप्लाई कम होगा तो बच्चा लैच क्यों करेगा? कम होगा तो बच्चे को लैच करने के लिए ज्यादा दूध मिलेगा नहीं, बच्चा थोड़ा दूध पी करके रोने लग जाएगा. तो कभी अगर ऐसा आपको फील हो रहा है तो आप क्या कर सकते हो, बच्चे को पहले अपना दूध पिलाने का ट्राई करो. जब बच्चा रोने लग जाता है तो ऊपर का दूध आप पहले उसको आधा दो जितना वो पीता है. अगर वो 60 लेता है तो पहले 30 ml दे करके बच्चे को फिर से ब्रेस्ट मिल्क पिलो. तो इससे क्या होगा, आपका डिमांड रेगुलरली बढ़ेगा. जब आपके ब्रेन को डिमांड मिलेगा तो मिल्क की सप्लाई भी इंप्रूव होगी. डिमांड देते रहना बहुत इंपॉर्टेंट होता है, क्योंकि जब आप अपने ब्रेन को डिमांड देते हो तभी उसको समझ में आता है कि कितना मिल्क बनाना है. आपका बच्चा अगर 8 बार दूध मांगता है और आप सिर्फ 2-3 बार उसको फीडिंग कराते हो तो आपके ब्रेन को कैसे पता चलेगा कि मिल्क और बनाना है? तो इसलिए आपको रेगुलरली बच्चे को ब्रेस्ट पे लगाते रहना चाहिए. और अगर बच्चा ब्रेस्ट पे बिल्कुल नहीं आ रहा है तो आप एटलीस्ट पंप या हैंड एक्सप्रेस करके मिल्क को रेगुलरली एक्सप्रेस कर ले. नेक्स्ट क्वेश्चन इज फ्रॉम कुसुम, मिल्क सप्लाई बढ़ सकती है क्या? हाँ बिल्कुल कुसुम, बिल्कुल बढ़ सकती है. मेरे पास ऐसे भी बच्चों की मदर्स होती है जिनके बच्चे 1.5 साल 2 साल के होते हैं और अब वो री-लैक्टेशन कराना चाहती हैं. बिल्कुल उनकी भी डेफिनेटली मिल्क सप्लाई इंप्रूव होती है. इसलिए आप ये बिल्कुल ना सोचें कि मिल्क सप्लाई क्या कभी भी बढ़ सकती है. मुझसे 1 महीने की बच्चे की माँ भी पूछती है और 1 साल के बच्चे की माँ भी सेम ही क्वेश्चन पूछती है, और सबके लिए मेरा आंसर एक ही होता है कि हाँ आप वो बिल्कुल कर सकते हैं. बट रेगुलरली आपको प्रोटोकॉल जो हम बताते हैं उनको प्रॉपरली फॉलो करना चाहिए, जिससे कि आपकी मिल्क सप्लाई इंप्रूव हो और बच्चा ब्रेस्ट फीडिंग अच्छे से कर सके. नेक्स्ट क्वेश्चन इज फ्रॉम विंध्या. I am breastfeeding my baby, but can I use bottle to feed formula milk? You can feed the baby with a bottle, but you have to always remember about the mid bottle feeding. And when we talk about mid bottle feeding is when you are giving formula milk to the baby. Once the baby has taken half of the milk, remove the bottle and take the baby back to the breast. This way, if you create that mid bottle feeding cycle every time, slowly the baby will start taking less of the bottle and will come more on the breast. So this way you can get your baby from bottle to breast, but you need to do it consistently for every feeding session. Next question is from Sandra. My baby is still hungry after feeding on both the breast, so I am forced to give formula milk. What to do? So that's okay, Sandra. If this is happening, then you need to just work on improving the milk supply and also by on improving the supply and the demand. As I told you just in the starting of the session, how to do that. So this way you can just work on it. And if you're still facing issues, you have tried a lot of things, then you can reach out to our team of expert doctors and they'll look at your case and will guide you accordingly. We'll give you a proper treatment plan so that you can follow it. So just reach out to the team tomorrow and you can just get your consultation done with them, with the doctors. Next question is from Pooja. Milk oversupply issue while breastfeeding the baby. अगर मिल्क का ओवर सप्लाई का इशू आ रहा है आपको तो आप बच्चे को फीड कराने से पहले थोड़ा मिल्क को हाथ से एक्सप्रेस कर लें एंड देन आप बच्चे को फीडिंग कराएं. अगर आपको उसके बाद भी दिक्कत हो रही है तो आप बच्चे को फीडिंग कराते समय ब्रेस्ट को इस तरह से होल्ड करें कि ब्रेस्ट को आप दबा के पीछे खींच करके चेस्ट की तरफ फिर बच्चे को फीड कराना शुरू करें, और जैसे जैसे बच्चा दूध पीने लगे धीरे धीरे उसको छोड़ दें. तो इस तरह से बच्चे को एकदम से जो शुरू का प्रेशर आता है मिल्क का वो नहीं आएगा, बच्चा कंफ्यूज नहीं होगा, बच्चा परेशान नहीं होगा और बच्चा आराम से फीडिंग कर पाएगा. अगर आपको ओवर मिल्क की सप्लाई का इश्यू है तो भी आप आराम से उसको मैनेज कर सकते हैं. So these were the questions which came on which have come on the Google, and now let me take the questions which are in the Q&A box. So first question is from Shravanti. My kid is not latching at all. Now baby's age is 1 month, 7 days. Now I started pumping. Is it work to increase milk supply? Yes, Shravanti, it will help to improve the milk supply, but I would suggest your baby is just 1 month, 7 days old. So what you do whenever you are feeding whenever the baby is demanding milk, you first try to put the baby on the breast, and once the baby starts crying, you give half of the amount and then take the baby again on the breast. If still the baby is crying, then you can give bottle feeding to the child, but your milk you need to pump then. So if your baby is not at all latching, then obviously you have to regularly pump. And for pumping, you can do a lot of pumping sessions, like in the way, like you can do power pumps also, you can do regular pumps also. So these things will help to improve the demand for your brain, and your milk supply will improve. But one thing I suggest to all the mothers, don't try to pump for a bigger time, like pumping for 1 hour, 1.5 hours will not help you. Instead of pumping for a bigger duration, try to pump at regular intervals. That will help in a better way. Many times mothers tell me that they pump for 1 hour or 1.5 hours, and once in a day they are doing that. So that will not help. If you are pumping for 10 to 15 minutes, but you are doing it like at regular intervals, that will give a regular demand for your brain, and your milk supply will definitely increase with that. So instead of doing it once in a while, try to do it regularly. And first, I would suggest to put the baby on the breast. If the baby is not coming on the breast, not cooperating and refusing the breast, then only go for pumping. So since your baby is just 1 month, 7 days old, Shravanti, you can definitely do that. So please try to put the baby on the breast first. And then if your baby is not coming on the breast, you give mid-bottle feeding. Still not coming, then you can pump. But yes, pumping will help to increase the milk supply. It is basically the demand which we are creating for the brain. So if the demand is there, then the milk supply will definitely increase. So don't worry about that. Next question is from Komal. Ma'am, I'm giving my 2 months old formula milk. ज्यादा सप्लाई के लिए मैं ब्रेस्ट पंप यूज करके मिल्क दूं? हाँ, आप कर सकते हो कोमल, लेकिन मैं आपको बार बार एक ही चीज बोल रही हूँ कि अगर आप ब्रेस्ट पंप यूज करना चाहते हैं तो आप कर सकते हैं, लेकिन इसका मतलब ये नहीं है कि आप 2 महीने के बच्चे को ब्रेस्ट पे लगाएंगे नहीं। आप जब भी बच्चे का डिमांड होता है तो पहले आप ब्रेस्ट पे लगाइए उसको थोड़ी देर। अगर बच्चा थोड़ा दूध पीता है, 2 मिनट पीता है या बिल्कुल नहीं पीता, आप उसके बाद पहले उसको आधा अमाउंट जो वो फॉर्मूला का लेता है वो दीजिए, उसके बाद उसको ब्रेस्ट पे फिर से लगाइए। अगर इस बार भी बच्चा कोऑपरेट नहीं करता है तो आप पंप कर लीजिए, लेकिन आपको हर बार बच्चे को ब्रेस्ट पे लगाना चाहिए। इससे क्या होगा कि आपका मिल्क के तरफ बच्चे का डिमांड बढ़ेगा, आपके मिल्क का सप्लाई भी इंप्रूव होगा और बच्चे के ब्रेस्ट पे आने के चांसेस भी बढ़ेंगे। Next question is from Ankita. Which tablet and powder for increasing the breast milk supply? So Ankita, it is not only about powder and tablet. You have to follow the other protocols like I told you about improving the hydration, improving the flow. And when we talk about tablet and powder, the powder is lactomagic powder and tablet is moringa morico tablets. So these two things are important, but there are some other medicines also which are required if you have a milk supply very low. If your milk supply is like fine and you are not giving formula milk more than 2 to 3 times, then these two things will definitely work. So lactomagic powder has to be taken 2 tablespoons thrice in a day with water or milk, preferably with milk. If you're asking about Morico tablets, it is Morico tablets have to be taken 1 tablet thrice in a day. So this is the dose, and there are other medicines, but that they are allopathic medicines which have to be taken only under guidance of a doctor. So if you need any help about lactation, you can reach out to the team tomorrow and you can book a consultation. I have 3 more doctors in my team. You can take consultations from them and you can resolve your issue. So see, breastfeeding is not going to like last for a very long time. You have a small window. So if you are facing any kind of issues, please don't waste time. The days will pass like anything and you will feel that, oh, I missed that thing. So that's why if you are having such issues and if you are blessed to know that you can get your issues resolved, then please don't wait. Many times mothers come to me and they tell me that, ma'am, I didn't know about that there are people who can help me in breastfeeding. So if you have come to know that you have some help, then please don't leave that, like don't just ignore that. Get your issues resolved if you are facing any kind of issues related to breastfeeding. So I can definitely say that if you want to take any kind of help, you can reach out to my team tomorrow and get your consultations done and get your issues resolved. Next question is from Komal. Ma'am, मैं दोनों breast से पहले देती हूँ फिर फॉर्मूला मिल्क देती हूँ। जब वो सो जाता है इसके बाद भी मुझे पंप करना चाहिए। तो अब आपको यहाँ पे दो चीजें देखनी है कोमल। अगर आप बच्चे को ब्रेस्ट फीडिंग कराने के बाद अगर आप देखते हो कि मिल्क का कलर अगर डार्क व्हाइट आ रहा है, मतलब थिक व्हाइट आ रहा है, तो आप पंप जरूर कर लीजिए, क्योंकि थिक व्हाइट मिल्क आ रहा है इसका मतलब बच्चे ने ब्रेस्ट को खाली नहीं किया है। अगर आपको बच्चे को फीडिंग कराने के बाद अगर मिल्क का कलर बिल्कुल पतला सा, बिल्कुल ट्रांसलूसेंट सा आ रहा है, तो आप खाली बस, अगर आप मिल्क बढ़ाना चाहते हो तो आप थोड़ी देर के लिए हाथ से ब्रेस्ट को मिल्क को निकाल लो। अगर आपका मिल्क सप्लाई अच्छा है, आपको ऊपर से फॉर्मूला मिल्क नहीं देना पड़ता है, तो आप इस चीज को छोड़ सकते हो। लेकिन अगर आप मिल्क सप्लाई बढ़ाना चाहते हो तो अगर थिक व्हाइट मिल्क दिखता है तो आप पंप करोगे, और अगर आपको थिन व्हाइट मिल्क दिखता है तो आप खाली हैंड एक्सप्रेस करोगे तो भी चलेगा। Let me take questions from here. So first question is, what is fore milk and hind milk? So fore milk or hind milk? There are two kinds of milk when we talk about breast milk. First is the fore milk. Fore milk is very thin and it is translucent, while hind milk is thick and it is like quite white, like a pearly white it can be. So what is the difference? When we talk about fore milk, that is rich in antibodies and rich in proteins that help to improve the immunity of your baby. And it also like helps in improving their thirst. They don't feel more thirsty. And when we talk about hind milk, it improves the baby's weight, and it has got DHA, which improves the baby's brain development. So both these things are important. Fore milk and hind milk both are important, which you need to give to your child for an optimal growth. Next question is, what is the name? I am not able to read. What should be an ideal weight for a 2-month-old baby? So it will, for a 2-month-old baby, you have to see the birth weight. So it should be always 200 grams in a week. So if your baby was born 3 kgs at birth, so baby should gain 3.8 by first month, and then you have to add 200 grams per week. So this way you can see the baby's weight. After 3 months, it should be around 100 to 150 grams in a week. So this way you will be able to know what should be the age of your baby as per the birth weight. Next question is from Bhanu. And how to know that your baby has got sufficient milk or not? So you have to always see the baby's weight gain. That will help you to understand whether the baby is getting enough milk or not. Second thing is, you will feel that the breast has become lighter, but don't only depend on that. You have to see the baby's weight regularly. If the baby is gaining weight and the formula milk is coming down, then that is definitely helping in improving the supply, and obviously that will help to decrease the formula milk if you are giving it to your child. Next question is from Harshada. Ma'am, can you please add the powder and tablet name in the message box for improving breast milk? Will be helpful. Yeah, I will add it, but I would suggest that you should have consultations first, because doses and all that needs to be understood. So it is Lactomagic powder and Morico tablets. So I hope, okay, I think it was not visible. So I'm changing the settings again. This Lactomagic powder. Morico tablets. So good to see that there are less questions now. So all of you are becoming smart day by day. So you don't have much questions, which is good. So just keep doing whatever you all are doing regularly. Just take help whenever it is required, and try to follow the techniques and the things which I regularly tell you all. So just do that and stay happy. So I have made a new course on pumping. So many mothers have a lot of issues around pumping, which pump to use, how to use a pump, how to store the breast milk, how to use the breast milk, how to improve the milk supply with the pump. So all these questions, because they are coming regularly to me. So I have made a course which is focused on pumping, how to improve the pump and how to do all the things you need to know about the pump. So I'm launching that course next week, and it will be a recorded 3-hour session where are different kind of queries related to pump will be mentioned in that. So any of you who is interested in knowing that pump recorded session, and it will be a recorded session, so you will have all the recordings with you, which you can like refer whenever you want to refer that. So if you want to know the details of that, you can just message me, you can DM me, and I'll send you all the details. So right now, because I'm launching it for the first time, so I'm giving good 50% discount into that, which will go away once it is like, once it becomes live. So you can just DM me and then I'll just share the details with you. So that's all for today. Thank you so much and take very good care of yours. And last question I'm taking from Sadia Siddiqui, which has just come now. Can I relactate my baby after 6 months of his age? Direct breastfeeding. So when we talk about relactation is about improving the milk supply. Then definitely for a 6 months old baby, you can relactate by improving the milk supply. Now, when we talk about direct breastfeeding, that may be possible or may not be possible. That will depend on knowing whether the baby has taken breastfeeding before, what was the last breastfeeding session, did the baby take breastfeeding previously, anything. All these questions need to be understood first to answer the question whether the baby can come on the breast or not. By improving the milk supply, that can definitely work for a 6 months old baby. Komal, yes, you will get the recording, Komal. The recording of this session will be done on, it will be posted on YouTube, which is available freely. So you can just type my name, Dr. Tanema Singhal, on YouTube, and you will get my channel. There are all the AMA session recordings are there. You can watch them. And there are a lot of questions which I answer every week. You can just go through them. And this recording will also be there most probably tomorrow or day after tomorrow. Harshida asked me, most of the things as my baby demands for milk compared to daytimes. Sometimes I feel like I am going low in supply during night. What can be done? Simple concept about improving the milk supply is demand and supply. Maybe in the night the baby is sleeping well. That's why you are not creating more demand, definitely. So that's why please try to have the demand and supply session in the night also. For a few days, it will help to improve the milk supply, and then you can go for demand feeding as per your child. So this will improve the breast milk supply and in the night also. And as per the things which I just told you about Lactomagic powder and Morico tablets, since you are having issues only in the night and you are not giving formula feed, then you can definitely try them and it will help. Komal says, thank you so much, ma'am. Most welcome, dear. There is one more question from SJ. My baby is 3 months old, facing and finding low milk supply. My milk supply is low in the evening. How to increase the milk supply? So SJ, I have answered that in a deep today in the mid of the session. I think you have joined the session late. So the recording will be put on the YouTube tomorrow or day after tomorrow. You can go through that recording and you'll understand how to improve the milk supply. And specifically, if you are facing issues in the evening, that is very common. So evenings, babies are doing cluster feeding specifically for around 3 to 4 hours. That is fine. And your baby is 3 months old. So the baby is going through a growth spurt. And during growth spurts, there is the feeling that the mother feel that the milk supply is low is definitely fine. You just need to follow the protocols for a few days and it will be definitely back on track. So don't worry, SJ. You can just watch the recording tomorrow. Padma asked me, ma'am, my baby is 3 months old and I didn't try much in starting, but now anyhow, I want to put her on totally breastfeed. Please help me, ma'am. So Padma, if you are facing issues about breast milk or are facing issues with the latching, I have answered those questions. Please watch the recording. I think you have joined the session late. Try to join at 8 p.m. regularly, girls, so that you get the answers of all the questions which I answer. Mostly questions are usually repeated. So that way you will get the answers regularly on every week. So just watch the recording for now and try to be there on live next Friday so that I can answer your questions live. It is difficult for me to answer the same question again and again. You can just watch the recording. It will be helpful. Next question is from Sadia. I fed my son directly from breast before 3 months. After that, supply was constantly low and he switched to the formula. That's okay, Sadia. If your baby has been on breastfeeding 3 months before, then you can definitely improve the milk supply. So improving the milk supply, and there is good chances that your baby can come on the breast also. Okay. So I think we are done for today. Thank you so much. Sadia, most welcome. You are most welcome. So let me see. There are no new questions here also. So take care, everyone. Good night and take very good care of yours. And reach out to me like next Friday. I'll be here live again answering your questions about breastfeeding your babies. Anything related to lactation, I'm all there. And for pumping sessions, if you're any one of you who is looking for a recorded proper session on pumping, you can just message me or message the team. They'll give you the details about the pumping session. Take care. Bye-bye, everyone.